right, so my name is Jen Beach. I see lots of familiar faces here. I'm Dr. O's athletic trainer and coordinator of patient services, and this last panel discussion is mostly going to be focusing on our late-stage rehabilitation and return to sport. So we have 3 expert panelists up here who this is what they specialize in. Feel free to wave me down if you want to ask some of your own questions. First question that I'm going to chat with you guys about is during the late-stage rehabilitation phase, how do you balance or transition the primary focus from tissue healing back to functional movement?
So I want to start off by saying, when I see a patient, usually it's about 15 minutes in the room. All right, so they come in to see me post visiting their physical therapist. And I usually observe more of a holistic patient when they come in. They're where they are mentally. I'm huge about form, so most patients don't like me. When they have surgery and they come in, I'm like, well, you need to take a step back in your PT a little bit. So a lot of times when they come in, I am like, okay, so you are doing really well. You're 3 months post-op, so you're ready to go out there and get going, but there's still some healing going on. Most of the time it's that capsule, all right? So ligaments take a while to heal overall. So a patient may flare up in the capsule area. And when they come in, they're like, I'm doing everything, you know, I'm doing really well in PT. My physical therapist told me I'm doing really well. I think the surgery failed because I'm in so much pain in my hip. And I'm like, stop for a minute. You're 3 months post-op. Tell me a little bit more about, 1, your goals. 2, what have you started doing new in physical therapy? A good example, I had a patient recently who went from walking the track 2 times to 6 times and increasing weight at the same time in PT. And now she is feeling well enough, but she's taking her kids to school. So I'm like, all right, let's just narrow all that down. You're doing a lot, all right? And you're back to work 1 day a week. So when I looked at her and said, you need to scale back some of these things. It's either you focus on strength, which is what I would. I'm huge on glutes as well. Love a glute workout. So I'm like, you know, scale back. I want you to strengthen your glutes. The track, go back to 2 times around the track. And I got the saddest face ever. You know, it was, where is the doctor at that point? All right? So, you know, I just basically look at the patient holistically, mentally, where they need to be, talk them through that phase, look at their strength. I am huge on form, so if I come in and see a bad squat, I am literally looking at you when you're squatting, all right? So they hate it when I have to tell them, all right, I think you're squatting incorrectly with too many squats, so we need to fix that.
I guess to answer that question, I'm typically seeing athletes coming in there somewhere between like the 3-month post-op situation, maybe 4 or 5. So I'm pretty much assessing, right, like I haven't been treating you for the past 3 months, right? So like where are you right now? So we start from the top, like what does your range of motion look like? We're gonna get goniometric measurements. We also have a couple of things at the gym where I can kind of get more of like a 3D look to see how you're integrating from an open chain position versus more of like a closed chain position. Some of those things change once you get your feet on the ground and like what that looks like from a joint mechanics standpoint. We're also gonna do strength, right? We're gonna do the manual muscle test. If you know they are performing really well on a manual muscle test, and I may look at what that looks like using more of like an objective measure, like a 10 deck or something like that. We also have a couple of things like force plates. So I'm like, hey, if you have been in PT for 3 months at this point, like I would imagine you got a pretty good squat, right? So let's see what that looks like on a force plate, looking at asymmetry side to side, and then we're also going to look at what that looks like single leg, to how one leg accommodates the full weight of the body. Once we do kind of like that preliminary screen, then I'm like, hey, our tissue healing wise, right, at about that 3-month mark, most things are pretty healed, right? Unless you have a couple of things like soreness or maybe a little stiffness that we just need to work out, but at that point, I know that we have checked all of like our primary boxes, range of motion, strength, and then function. After that, I'm going to see how you move throughout your additional movement patterns, right? What does a lunge look like in 3 dimensions, right? Like, can we hinge really well? And then, right, we may put a little bit of load into that squat to see what that looks like. That's kind of like when I come in, what I'm checking off. And if we're doing those things well and we're doing the basics well and you're coming back and you're like, all right, Lance, like that initial session went great. The initial load that we used was was easy, right? I felt really good, didn't have any complications. Then we kind of build that out from there. I'm also thinking about, one, where you are versus where you're going. So if we're thinking about getting ready to return to running or getting into some of those upward phases of activity, then like what can I titrate in on the front end that gets you more comfortable on the back end? So we may not just start like, hey, let's just go ahead and start running. For us, we have a Spark machine, which is kind of like an elliptical, but we can kind of shift the gears in terms of like the running form. So that's an easy way for me to get the athletes on there to start working on that running form, but you're not necessarily taking the impact. And also just for them, right, the cardiovascular health of just like, hey, let's get on here for a few minutes, get your heart rate up, and let's get you moving. A couple other things that I would do in conjunction with that would be like assisted pogos or some stuff where we're now just getting a little bit more of that like intro to plyometric load without it being super intense. And then all of those things kind of bridge together from the tissue healing stage to now maybe like the strength building and prep stage to then now we're gonna eventually, I know we're getting to the return to sport, running, return to activity phase. So we try to find a healthy balance of like putting in a little bit of that dosage so that over the course of the treatment, it doesn't feel like we're throwing a bunch at you at one time, but just kind of piecewise getting you prepared to where you want to be at 5 to 6 months. So.
We've made some great points, talk about lifestyle and what our patients are doing every day, if they're active, if they're trying to return to sport. And as we deal with our patients, they want to do more. We have a saying in our office, more is not better, better is better. More is just more. So if you can incorporate that, little sayings like that, as tissue begins to heal, our patients want to do more and increase loads and increase weights because that's what they feel like we need to do. But let's perfect that squat. Let's perfect the motions. Let's perfect the movements. Let's perfect our balance to where we make sure that we have a super solid foundation before we go to the next step. And I think that's important in the patients realizing that they're like, I don't need to run tomorrow. Like this is a marathon of our process. We have plenty of time. There's no rush. What's our goals? What are we trying to do? One step at a time. We got to move at like a step-by-step progression. We can't just continue to increase distance and increase weight all at the same time. So I think education, having those relationships, and just having those open conversations about, hey, we're going to get there. Trust me.
Lance, you kind of talked about some specific objective tests or functional benchmarks that you can assess to make sure that an athlete is ready for sport. How are you guys ensuring that these tests are more sport specific and take into account like the demands of an athlete's specific role, specific sport, and the specific expectations of their sport?
That's a really good question. It's kind of like taking what you see objectively, but then also trying to find ways to have them do a few things and assess quality, right? So it's objective number of like, hey, this is what you're able to output. This is what we get objectively. But then also, we're also looking at like the quality of the movement, right? Like the objective tests are just a task, right? So if I do a bunch of objective tests, the athlete is eventually just going to get really good at the task. That doesn't necessarily tell me the quality or how they like integrate that into more of an athletic movement, right? So you're trying to find that balance of, hey, like one, are the numbers looking good? And then two, qualitatively, like how does it look when we are achieving those numbers? Because as we all know, like if you're working with an athlete, one of the best things they do is just compensate in as many ways as they can. A lot of it is not cognitive. It is just more of like, this is what the body is choosing to do because everything you do as an athlete is objective. So you're really just trying to accomplish a task. And so however they can do it, they can do it. And if it looks like they have 80% symmetry, right, in their mind, they're like, all right, great, like we're getting there. But I'm like, well, not so fast because the way we got there doesn't actually look great. So yes, we got the number, but now let's get the number and look really good doing it. And then now let's find a way where we can get on the turf and do shuffle drills or some light change of direction drills or a box jump, right? And then now let's see how the objective number looks to an actual functional task. And then now compare the two because the task is just a task. If I do an isometric test over and over and over again, eventually I'm just naturally going to get good at the isometric test, but that may not tell me how well you can jump or how you can land like with some stability. So it's taking what you get numbers-wise, looking at the qualitative picture, looking at the athlete, and then also looking at the whole body, like how is the system integrating together well to give me this output and give me this number. And then now let's see in small doses with skill-specific stuff on the turf or the field or whatever you guys have access to now let's see how that correlates, right? Like, do they really have good single leg stability when they change direction, like what's happening at the ankle, knee, and hip, or the trunk, and then now let's correlate that to the numbers that they have, and then from there you can say, all right, cool, we've checked all the necessary boxes to move forward.
All right, another big part of the return to play process is assessing the emotional and mental readiness of athletes to get back on the field, get back in a game. How do you assess their mental and emotional readiness, and what are some common psychological barriers that you see that athletes face at this return to play phase? And then how do you address those? What are we doing to help them get past that barrier?
I feel like in the clinic, the best way I assess that is first asking the athlete, because we have athletes and we have people to participate. As an athlete, what are your goals? When they tell me what their goals are, then I assess their strength. And then we sit down and have a conversation as, where are you right now in reaching your goals? I feel like most of the time the biggest fear is not being able to ever return to that sport. So based on who I'm speaking to, if it's a college athlete who want to see themselves in an NFL or something bigger than just school, college, you have that conversation. Well, listen, buddy, if your ACL is not strong enough to play now, you're not going to be able to play then. So best we take time to get you strong enough where you could really understand your body, really understand the game, and get back out there and not have to return to see another PT again. Or we can push past this really quickly, get you out there, and then you're done. And I feel like with athletes, you have to be straight up honest with them, give them goals, assess where they are mentally. And sometimes it might take getting a therapist involved because it's such an emotional roller coaster coming from an athlete myself, where you have so much eagerness to get back out there and do what you know in your heart you can do, and physically cannot.
Yes, the mental aspect of it is very important. Once an athlete decides that they need surgery, everybody in this room knows that they're not part of that team. They can't participate. The mental of it's terrifying. It's the worst thing that's ever happened to them. And how do you be there as a clinician for them? You have to support. You have to guarantee them that, I'm going to be with you from the beginning to the end. The highs and the lows, we talk about the stock market, there's going to be good days, there's going to be bad days, but it doesn't matter. We're still going to keep progressing. I've got a picture of the best day is today. It's sometimes it's high, sometimes it's medium, sometimes it's low, but we're just going to keep getting better every day because it doesn't always go like this when it comes to mental capacities and the struggles. And we're just talking about the physicalness of what they're doing with a team. That doesn't account for how I can't sleep at night because it hurts. It's hard for me to study because I can only study for 20 minutes and then I'm distracted from the pain in my hip or the pain in my knee or anything like that. And all of that plays a part in their psyche and how they feel. And that affects their rehab. And we've probably all seen it, how sleep has a big part of it, nutrition has a big part of it, and all these things. And as clinicians, we're called to be there to help them realize that and to walk them through that. Is it easy? No, but we have to celebrate and we have to reaffirm that, hey, we're going to start walking soon, and you have to, be positive about it. Hey, do you remember 6 weeks ago how you were in bed and you couldn't move? Hey, look, we're sleeping again, and we're going to start doing these things, and just being positive and reaffirmation of hey, we're going to get there. We're going to get there. It takes time.
Yeah, I think the biggest thing when it comes to the rehab process is just celebrating the small wins. It's every time they do something big or small, it's just hey, really good job here, really just reinforcing that. I think for them also just the dopamine spike of hey man, I really did that and it's been a while since I've done it, especially in something that gets them closer to feeling like an athlete. It's like, all right, cool, like we did that jog, really good job. We went through a basic warm-up, right? Like super, super awesome job. Like now this is something you can do routinely. This is something you can do regularly just to like get back into that routine of moving. And then also like if we are thinking about when we have those like markers of like assessment day or we're testing, right? Like you're trying to like pre-plan that so you know that I'm not going to put you in a position on test day that like we haven't done before, because sometimes like I see that can be some of the like biggest anxiety provoking moments where it's just like, hey, we're going to do a hop test today, and they're like, oh my God, it's test day, like am I going to do this well? Like, what do the numbers mean? And it's like, well, no, we've already done some single leg pogos. We've already done some like deceleration drills. We've already prepped you physically for this. Now it is just more of like, hey, let's just compare how much better we are today than we were 3 weeks ago, right? That's all it is. And so trying to simplify those moments so it doesn't feel like such a big thing and doesn't feel like such a, maybe even like a loss if like the numbers aren't there yet, right? So it's just like, hey, this just lets us know this is where we are now. We need to just continue on this track to make these gains. But like always just trying to be in a way of like, hey, I'm celebrating you. I'm on the same team. What are you going through in those moments, and like having those conversations. So if you do need to sit down for a moment of a session to just say, hey, like what are we anxious about? Like why do you look anxious? Like what is going on? And like let's talk about those nerves. Let's talk about what we've done. Let's talk about how this is helpful, and just kind of like meeting them where they are, because they need somebody that's on the team with them and not someone that's just like, oh, go do this, do this, do this. But hey, let's just take the time and get our mind right before we do this. And that may mean like, hey, let's not test today. Like clearly we aren't there mentally, so hey, let's come back to the table a couple of days from now and let's try this again after we've just kind of like reestablished where we are, where we want to go, and how we feel about this process right now.
Yeah, and I know that loss of confidence is a big thing as athletes return back to sport, but that also that performance anxiety, but especially that fear of re-injury, I think I see a lot. In that final phase, injury prevention is really critical. What are some of the most evidence-based and effective strategies that you guys use to minimize the risk of re-injury as athletes return to that high-intensity, potentially contact-like sport?
One, keep the main thing, and let's not try to like get super complicated with it, even though we get closer to that return to sport. And then also finding like basic things that work. So just like, hey, what is our warm-up strategy once we get back into practice, right? What are we doing from a movement standpoint? What are we doing from a like warming up our tissue standpoint, and then also what are we doing from like an activation and stability standpoint, right? I think as the level of skill increases, right, from like a high school or a collegiate athlete to a professional athlete, right, like your routine is very important in terms of like how you get ready for practice or how you get ready for games. And so like giving them something that can be routine for them to say, hey, one, we've already done these things in the clinic, so you know how to do this independently. And then also just say, hey, this is kind of like your block of time to get your body ready to perform, and making sure that you're just trying to cover all of the basics from either mobility, activation, and just more of like a neuromuscular prep or something like that, right? Just to kind of get them going through practice. But I think for me, it's just having something consistent that they feel comfortable with, that they can essentially do anywhere, right? Like if they're traveling or something, if they're a high school kid and they're traveling to a game or a tournament, right? Like giving them the tools that they have. Like you got your bands in your bag, you got a foam roller, right? Here are your 5 to 6 exercises that I really want you to do, and then let's keep track of like what the outcome is, right? Like, all right, did this work well? You're back in the sport. Are you feeling really well, or did you still feel a tweak here or something there? And then let's just modify so we can kind of get that individualized program for you.
I'll piggyback off of that. See, when they come into my office, the clinic, I usually say, here's what, you're ready to go. So like every professional athlete, there's a trainer, all right? They have someone in their back pocket that they can use, some things in their back pocket that they can use. So I'm like, the PT gave you some workouts, didn't they? I always ask that question. Do you have those at home? Yes. You're going to take those with you, and you're going to use those at least 3 times a week, and you're going to continue building on those exercises because it was constructed for you as an individual. So you're going to continue working through those exercises. And if you have at any point you feel like you hit a wall, we can always revisit PT to see if you can get some changes in your physical therapy workout. But the main goal is you have to keep moving. This joint is not your native joint anymore. All right? So the opposite side is always going to feel different. You're going to lose strength in this area quicker than you lose in the opposite area. All right? It doesn't mean that it didn't work, it doesn't mean that you're not doing a good job. It just means that you need to put forth the effort to keep this joint healthy.
Yes, routine is very important. As we had talked about also is, each individual is different. So a warm-up for Jason is different than a warm-up for Ben versus even a female, and that's another different subject of males versus females, but still, what works for one person doesn't mean it's going to work for the other. If it's, single leg bridges, or if it's band workouts, or if it's stretching, but there needs to be some type of maybe a tissue warmth if they're getting into a hot tub, or if you have hot packs, or you have massage guns, things of whatnot. Foam rollers, those are all huge keys to help some of my guys that have experienced hip pains and hip that range of motion. Some guys have different stretches that they prefer. Some like figure fours, some like lunges. Some people like to do a step down and combined with a TKE. There's a lot of different tools out there, and just trying to find the right ones for the right people. And we don't need 10 of them, but just a few that they can kind of do well, as opposed to doing a lot that they just kind of skim the surface. I think that's important, just to make sure that it's correct in the purpose of what they're doing, to make sure that they're ready to perform.
And I see them at the 2-week mark, and especially for our active people, I plant that seed pretty early that they're going to be a hip patient for the rest of their lives. And I ensure them that we should all probably be doing more hip and core activation, and it's not just them, but that in an effort to maintain all of this, they're going to have to work for it for the longevity of their career and the longevity of their life. So once an athlete has returned to sport, how are you engaging them in maintaining that long-term hip health to prevent further injuries, but then to also ensure that they have longevity in that hip joint and preventing chronic conditions, especially in a space like a university where you're seeing them for a full 4 years, which is different than in a physical therapy session where you can see them for 6 months to a year and then they might pop back up. How do you manage that new reality for them that they are going to have to maintain this health for the sanctity of their sport?
Yes, sometimes as I finish, I just talk about, you talk about pregame and pre-practice, but there's also post-game. What can we do post-game? What can we do post-practice? What can we do at home before I go to bed? What can I do on an off day? With hip health and with elite athletes and athletes that want to get better, they're still working every day. And whether it's being a hot tub, foam roller, stretching progressions, or if it's getting massages, soft tissue massages, things of that are extremely important for not only athletes and athletics, but what does it look like 10 years from now? They've got to realize that, hip range of motion is important. They have to realize the importance of posterior chain activation. They got to realize that our hip, as humans, our hip flexors are naturally tight. So what can we do to try to alleviate some of those things? By the education and the relationships that we have with our clients and our patients, that's important to establish the certain things, not just short-term goals, but long-term goals. And I think that's what doctors and physicians do, is let's look at the short-term gains, but not only that, what's going to help you long-term gains. When I know you're thinking about playing basketball or soccer or baseball or football right now, but one day you will not have that option, and you'll be 30, 40 years old trying to pick up your kids and play with your kids. So I think all that is very important, of the education, and again, establishing a couple routines, a couple exercises, a couple stretches to show them these are important, not today, but for the rest of your life.
For me, I think I'm just kind of blessed to be in a situation where once kids are done with the PT aspect of things, they return to sport. We have a whole host of performance coaches at our gym that do a really good job of just continuing to train them in season and out of season and preseason. So for me being in that space, it just gives me an opportunity to always check in. So there are kids I haven't seen for months from a PT standpoint, but it's always hey, how are you feeling? How's practice been going? Has your body been feeling really good? Hey, what's your post-practice look like? Big thing for me, since I work with quite a few high school kids, it's are you going to sleep? Are you eating well? Are you doing all the things from a long-term standpoint that don't necessarily have anything to do with the reason that you were seeing me, but more of hey, how are we making sure that you're doing what you need to do for long-term performance, long-term health, and eventually, like Andy said, just being an active adult, right? let's go to bed. Let's go ahead and put the games down. Like, let's get off of TikTok and let's eat a good breakfast, a good lunch. And obviously most kids are eating a pretty good dinner, but let's hydrate and let's do like all of the basic stuff to make sure that the work that we put in the rehab and to get you back to performance, and then also the work that you're putting in from the actual true like training performance standpoint, like let's make this stick for a while, right? Because as much as I enjoy seeing you in the clinic and as much of a good time we had, I actually really don't want you to keep coming back. Like, I don't want to keep seeing you for rehab. I want to keep seeing you in the gym. I want to keep seeing you train. And the best part of my job is to be able to like go and watch the kids compete. So it's like, if I'm seeing you, I want you to be just telling me, hey, Lance, by the way, I got a game this weekend. Like, can you make it? And I'm like, all right, cool. Let's make it. And let's see you do your thing that you do best, and not, hey, Lance, my hip hurts again because I'm not doing the maintenance routine that you said to do. So I think it's definitely a holistic approach with all of the like key stakeholders in the athlete's care, and that's also advocating that to their parents too, right? Like getting their parents involved to say, hey, you know, we put together a home exercise program for them, and this is now something that's going to be their maintenance program. Like, let's get you involved to make sure that they're doing this a couple times a week. Let's get you involved so you know that at the end of the game, like these are the things that are going to be really important in their long-term health, and let's get them involved so you don't have to continue to waste gas coming to see me, right? So like, let's go ahead and let's nip this in the bud so we can get them to do what they want to do as best as they can do it.
I do want to give us a little bit of time to open the floor. Does anyone have any questions for the panel that
I
we
have
want
one
to
thing
ask?
to piggyback off of.
Go for it.
It's interesting that you said that because usually that's when we discharge them, right, from clinic. And if they do come back, I would say 80% of them drop their exercises. Yeah. And I have to say, here's your PT script. Yeah. See you in 6 weeks. Yeah. And they're perfectly fine when they come back 6 weeks later.
You can have it.
I'll just try and talk loud. Andy brought up a good point. What is the difference that you would say for a female athlete? Like, I know when I'm treating a female athlete, I've many times had to have conversations about nutrition because they're the ones skipping breakfast before they come to see me in PT. So, like, what are some of those, like, considerations for the female athlete?
Well, I think nutrition and sleep are the two biggest components to recovery. And that just should be part of the conversation of what are you eating? Are you taking vitamins? Is it, do you need a collagen supplement? Things of that nature can all play a big part. As not a female, but nutrition is important to regardless if it's an uptick in protein after surgery. All those are important. But yes, it's a tricky situation when you talk about nutrition and when it comes to body image and such. So you just have to be smart and careful and use it as like it's going to sound no pun intended, but you got to use the nutrition as fuel to help them. Hey, if you want to get better, eating right will help you. As we have athletes and patients, it's like, well, so you're telling me if I don't eat fried chicken tonight, I'm going to be like, well, let's try, let's make baby steps and let's eat grilled chicken and try to increase vitamins, and let's try to increase our fruits and vegetables and start it out as a lesson of nutrition and how that can help their joint health. I don't know if I answered that or not. I'm sorry.
This hurts me to say that yes, males are different from females when it comes to that. This is one of those things in clinic that I try to spend a lot of time with females when they come in, when they talk about nutrition. Most females, you have to debunk that belief that carbs are not good. You can't enjoy life. You can't do certain things when you're an athlete. And to tell a female athlete, listen, you can eat. I need you to eat healthy. Another thing is to tell them, you can go and lift that weight. It's okay. You wouldn't turn into a muscular woman. They're scared to pick up that dumbbell. And I'm like, no, pick it up. Strength training, you need that. So the conversation does change in the room because then there's a lot of emotion that goes into play. And if you're speaking to a female with a mom sitting next to them who lives the exact same lifestyle of cutting back on calories and watching her weight, but she's not an athlete, she's not going to pass that on to her daughter. The daughter is going to do the exact same thing to maintain that weight, but is an athlete. And to try to explain to her, you need more than your mom is eating to get by and to heal. You know, when you have a male come into the room, you know he's eating all the carbs in the world. You know he's sleeping. You know, he doesn't care about his friends. He cares about the sport. The female cares about, sadly, the way she looks, the sport, and the way everyone else looks at her. So there's a lot of emotion going into your conversation with them.
I think you
You good?
Any other questions?
I guess to kind of piggyback off that, like, kind of Lance's reaction kind of embodies my question is like, as a male clinician, like, what are some things that we should be thinking about from the female's perspective to hear them as opposed to just be trying to tell them, because obviously it's an emotional thing as opposed to not so much factual, but it's the emotions are overplaying the facts at times.
Most female athletes want to play the sport, and they are passionate about it. Get an example. Find that female out there who is an athlete that looks really good, and break it down for them. Look at her. She's working out 5 days a week, but look at her diet. Look at what she's doing. She has to sleep. Make it more of an example and become their friend, because now it's a man telling them how they look, right? So it gets a little bit sticky. And it gets so for the female too, because if you're a female, I've had patients say to me things like, well, you look like you work out, you look like you don't even eat anything. And I'm like, I do, you know? I find examples when I speak to a female based on their age. The younger they are, I find examples. The older they are, I relate my lifestyle with theirs. You know, I was a huge runner. I ran a lot of marathons. I ran a fitness business for 15 years. You know, I got injured, and I had to switch, you know, my workout plan. You know, running is something I'm passionate about. I'm that girl that used to get up at 4:30 in the morning and would run 6-7 miles like that, come back home and go lift. There were times I'll drop my car off at a dealership and run back home, then run back and pick it up. You know? And one day woke up and I couldn't do it anymore. So I relate based on the age, and then if they're younger, I probably find an example so they can relate too.
I also think that there's a lot of power in empathy. So even though you may not have experienced their life experience, we see that in lots of situations, not just male to female, and expressing that, you know, trying to understand the situation that they're coming from. But then additionally, going back to basics, Anna Claire talked about in the early phase, talking about nutrition, there's energy need calculators where you can put in height, weight, gender, age, and their level of activity, and even just sit down with them and talk about macronutrients, talk about what carbs actually do. What do they do in sport? What protein actually does in sport? If you're finding that you're sore after all of your workouts, what are you eating afterwards? And having just very like factual baseline, but then patient-specific conversations about these are your specific needs. I'm sitting down with you. We don't have to always count and talk about calories, but you think that in order to be a successful female athlete or athlete in general, you have to be cutting this certain amount of calories. How much does your body actually need to be doing what you're doing? And there's lots of energy need research about sport-specific and what a dancer needs versus a volleyball player versus a football player, and being able to break down and look at those things and say, hey, you're not getting enough, and show them that versus what society can often tell is like, you're doing too much is a big part as well.
I want to just say one thing about that. That's very true, but read your audience.
Yeah.
Because I did psych as well, and some female athletes really struggle with calorie counts.
Yeah.
So it can go from one end to the extreme. So be very mindful of numbers in front of females too. So if your female is standing in front of you and you can tell that she's the type that would say something like, oh my God, I stepped on the scale this morning and was a pound more, don't play numbers with her, because that's a struggle. So you have to read that audience.
So just curious, as an athletic trainer and a physical therapist, at what point do you defer to the registered dietitian who deals with that population? Because we can advise, but that's not our lane.
Once you realize that anxiety is overtaking progression, it's time for you to back off because it's not your lane, right? They're coming in, they're not getting stuff done, they're not sleeping, they're thinking about it all the time, they're talking about it all the time with you, and they're not getting anywhere in their physical growth. Then it's time to say, you know what? I love to say, let me speak to my supervising doctor about this. I just love that part as a PA. But and it may not be that I don't understand them, but it's time to refer to someone else.
So I know working with professional athletes and Olympians and all, that we don't even let it get to that point.
Mm-hmm.
If it's that question and we can tell they need the guidance, we get them there immediately.
Right.
Before anxiety sets in.
Right.
It's like, you need guidance and you need a plan and you need a program with it before they get down that rabbit hole.
Yeah, which can make it difficult in the clinic, right? Setting, and if you have the resources, then great. But if you don't have the resources, you're stuck with this person, so then you have to step in as best as you can.
Well, we have a network,
There you go, we like it.
so we have a list of people around the country, and some of them do remote counseling and all, and say, why don't you contact this person, because they have a broader network.
Awesome.
You need that.
Yes, that's helpful.
I was gonna say,
Different question, it's not nutrition based.
Go for it.
You okay?
Yeah.
yes,
Switching
please.
gears. On the, like, return to sport aspect of things, if you guys could give me your, oh, I'm pretty loud, but, if you could give me your, oh, it's for the video. Hey, video. If you could give me your top objective return to sport measurements. I usually am at the 16-week point looking at like, all right, where we're starting that phase 5, phase 4 in stage PT, sort of switching over to more of the return. What are just a couple of your top measurements for readiness for return to sport?
Objectively, things can get tricky just because we don't want to chase tests. I don't want to chase how much we're leg pressing, but obviously there's got to be a 95%, same side. But I also know that what sport does leg pressing motion when you're on your back pushing up? Okay, so it doesn't. So, and that takes it to the functionality of it. Like, okay, I work with basketball guys. Can my 6'10" guy jump up, dunk the ball? Okay, well, now can he land it? Does he come down? Does he compensate? Is it more on one side versus the other side? Is that natural? When they're taking jump shots and doing pogos and things like that, is it symmetrical when they're doing it? Like I tried to say earlier, let's in those early stages, that's where it kind of comes out. Is like if we can do things really well when we have that extra time, I think that's when it shows up. There's hops, the triple leg hop test, the single leg triple hop test. Hop test side to side for 30 seconds. Anything where you're comparing left versus right. Now those are all clinical based, but at the end of the day, they've got to be able to run and perform on the court, on the field. So, is that sprinting? Is it knowing their vertical jump? Because I think that's important. Is it knowing what they are on the force plates, their force outputs, left versus right? Is it a pro agility drill? Where you have previous baseline recordings versus what they are post-surgery, which sometimes are kind of hard because not everybody just has all that information. Hopefully some of that can be dictated in the weight room because as clinicians, there's a point where sports medicine becomes strength conditioning, and that's where it's good to have a good network of people to where you can bounce ideas off of like, hey, we're really trying to work on, making sure that we're still concentrating on the involved side, but let's make sure that we're doing double leg deadlifts and squats and cleans and whatnot to make sure that we're getting back to that equilibrium. A lot of it is, what does it look like, subjectively when they're running? Can they run without a limp? Can they jump without, any wincing or any pain? Are they getting max, do they feel comfortable? Can they do lateral shuffles and whatnot day in and day out to where there's no visible compensation?
I'll pass this back on to you because I don't really do much of this. There are no numbers in my room. But I'm a huge fan of not making anyone, especially with the hips, no one should be running, I feel, personally, until after that 3-month mark. Like more into that 4-month, fourth phase, I should say. Because I'm seeing a lot of weakness, unilateral weakness. I do a lot of single leg squats in the room just to see how they're moving, then posterior chain I check. And that's usually my anterior hip pain person who started running. So I'm a huge fan of saying your body's like a car, you know? If you run it without gas, you're gonna shut down at some point, and that's where you are right now. So build. Focus on unilateral work, make sure they're really strong before you get them out there running, because then they're gonna come into the room and be really angry with me, because I'm gonna send them back to you.
Yeah, I kind of agree with Andy, right? Like, we're not always chasing objective measures, but I guess from a clinical standpoint, like, obviously symmetrical, like, range of motion, and we're also looking at strength, right? Like, I'm always going to come back to that just because, like, we just want to make sure that all that stuff is sharp, and we don't necessarily want to get too comfortable at any point just to say, oh, that was good, 3 months ago. Now I'm not going to check it. So, like, I'm always going to get into the routine of, like, checking that. From a functional standpoint, right, like single leg hop test, single leg triple hop test, single leg crossover, lateral hop test from side to side. If you are fortunate and you do have the force plates, right, then I'm going to be looking at your bilateral squat, single leg squat. We're going to be looking at counter movement jump, single leg counter movement jump. We're going to be looking at pogos, left to right. We're going to look at drop jump, right? And then we're going to look at single leg drop jump just to kind of see what some of those numbers are, especially when we're considering taking in gravity and just like hitting the force plate really hard, right? So like what does that look like symmetrically? And then again, right, what does that look like qualitatively when they do it? Especially if we're thinking about like the single leg hop tests and stuff, right? Like are they able to really do that jump, decelerate, stop that break, or like they double clutching it, or like is the knee looking a little bit funny, right? Like what does it look like qualitatively? Because you can have a 90% limb symmetry index there, but they aren't strong doing it, they aren't comfortable doing it, and the positions that they're in don't necessarily look great. So if we're just going based off the numbers, and you could potentially send kids back and like they don't necessarily have the true control and utilization to best perform that out in the on the field or the court or wherever they are. And then also, right, like we're probably going to look at some sort of like bilateral squat, single leg squat, or again, kind of like going back to like we have our sparks and that can give us like a force output. So like if we're doing some repeated sprints, can you maintain that same level of intensity over several bouts of sprints? Or like are your first 2 sprints really great, then your last few sprints are just really crappy, right? Like can you do that repeated effort? Because most of sport is bouts of repeated effort over and over again. So like what does that capacity look like as well? And then doing your best, right, in my position to like reach out to athletic trainers and reach out to other strength coaches that they are working with, just to like see what they're seeing as well, just to like see like are they at their baseline with some of their other lifts, or like how well do they look compared to maybe some of the other athletes once they like gotten back into maybe some sort of sport integration, maybe not fully ready to compete, but back into some aspect of sport, like how do they look, or reaching out to some of their sport coaches to just say, hey, like do they look conditioned, do they look in shape, are they moving well compared to maybe some of the other athletes on the team. So again, trying to find all the other stakeholders involved with the athlete's care and like bring all of that together so it's just not like one unilateral decision, and you can kind of just take in as much feedback as you can from other people that are surrounding the athlete.
Any other questions? Go for it.
Go ahead. Lance, hello. Yeah. How would you measure best like acute on chronic workload, especially coming from like the rehab standpoint? And you brought up the example working with other strength coaches. Are you talking with them to make sure like this is how much volume this guy is doing? Maybe I don't have to do as much because are you making those adjustments?
Yeah, in our space, since we do have some strength coaches, I try to make it pretty collaborative. So like since we're talking about the hip specifically, right, like once I see a kid and they are really functional in their movement patterns, maybe we've done weight that is close to barbell type weight, then I'm probably going to start bringing in some of our sport coaches to say, hey, this is where they are in the phase. Like our big thing here is let's get really good at our functional hinge, squat, lunge, carry, right? All of those movement patterns. Let's gradually load them up, and then I'm having that conversation with them, right? And then also the kid is also still seeing me. So like they may transition to maybe a brief moment where it's like, hey, you're now like strength training twice twice a week. You're probably seeing me once a week, and right, we're working on neuromuscular control, maybe some like other integrations into like light plyometrics and some skill stuff. Versus now the strength coach is taking over that progression there, and then now we're monitoring like, hey, how the 2 days go this week? You know, obviously like I'm seeing them in there, so I can kind of see what they've done. But like, hey, how'd that feel? Easy, medium, hard? Do you feel like you can be pushed? Are you having any setbacks where you're coming to me and you're like, hey, now my hip feels really stiff, tight, sore, or whatever, and then now I can relay that to say, hey, let's look at what that frequency was this week, like what was that weight progression this week over the past couple weeks, just to make sure that we're staying on track. But I try to do my best to let what other people do best do that best. So like I'm a PT that has a background in strength and conditioning and has spent time in the weight room, but I'm not a strength and conditioning coach day to day. So I'm gonna let them do their thing, and then we find a way to like bring that together. So then also the athlete feels like they always call it in our clinic like they're dual custody, right? Like they're with one strength coach for a couple of days and they're seeing me. And so for them, that also helps them feel like they have a team behind them, and it also helps build a lot of that trust of like, hey, I'm in a place where like I know, you know, my care is being taken care of, and if anything pops up, then we have what the coaches has been prescribing, what I have been prescribing, and then now let's see maybe where we have slipped up in some of those gaps, and let's get ahead of that pretty early. And if we have to communicate that with Dr. O at any point, then that just makes it a little bit more of a seamless situation. So like he knows what's going on.
I just want to say one thing about that. That was well said. Collaborating with the team is so important. I would highly suggest never freaking your patient out, because the minute they'll come to us in the clinic and they would say something like, you know, my PT think I hurt my hip, I popped a suture, and they're freaking out for like a week. So my sideboard is loaded with questions about their suture being popped out, you know? So I often say, if you have a question or you're concerned, it's something about this patient that looks a little bit different than usual, feel free to reach out to the team without telling the patient. Say, you know what, let me speak to, you know, Dr. O, let him know that you have some connection, all right, with that surgeon and his team, and let us get to some sort of, you know, decision on how we're going to approach this patient, because patients will freak out quickly and it's stuck in their head because they're scared.
Yes, the situation, the setting that I'm in, I work hand in hand with our strength coach every day. We've got a glass wall between the athletic training room and the weight room, so we do a lot of collaboration. And I feel like that is an amazing approach, an amazing system. You know, once they're into the weight room, they're probably not doing 100% max reps and weight yet. But at the same time, they're not going to be in the weight room working on balancing and bands. So there's other things that I can do as an athletic trainer. We can still heat, we can still do manual stretching, we can still do some massaging, we can still do a lot of the little exercises to get them primed for weights in their session in strength conditioning. So we're not overlapping, but at the same time, I'm not going to have him do a lateral lunge with me, knowing that he's getting ready to go with a strength coach and do deadlifting with them. So I think that's where just being on the same page and knowing that we have each other's back, and the strength coach can report to me, hey, can he do said X exercise? Well, let's try it, but you know the volume is way down. And I think that's how you integrate it into leaving the athletic training room and then doing more on the strength coach, more in the weight room, than hopefully even more on the court or in the field to where they're doing functional things. And I think it's an amazing relationship, and if you have that set up, it works really well.
All right, thank you, panelists. I'm going to pass the mic back over to Dr. O to close us out.
Round of applause for our panelists and moderator, please. Appreciate it. Thank you. Okay, y'all, that's our time. Now, I think takeaway from this whole day, I would say, is we're all one team, and I like to think of all of us as a think tank, to increase the quality of hip care in the area. So it's a conversation, like Sherman pointed out well. We should be conversating, we should be communicating constantly. Other thing I would take away is the importance of hip health to longevity. So we know that movement equals longevity, and movement without hip health is impossible. And so this is a critical thing. We've seen across the nation a change in people's strength, and it has a lot to do with our sedentary nature of life. What we can do here, we can really make some real impact. transitions nicely into the next point. So we know that sports health and community health are critically integrated, okay? We know the importance of injury prevention because we love to talk about fixing the ACL, fixing the hip scope. If we can prevent the injury in the first place, we can save that person from a lifetime of downstream issues. So we're having a sports injury prevention community seminar, likely August 9th. Date is still tentative. Please keep it in mind, maybe write it down, save the date. It's going to be at the new Henrico Sports and Events Center. Oh. For anyone interested in coming and seeing surgery in real time, please contact Jen Beach. She'll be helping coordinate shadowing in the surgery, probably be on Fridays most likely. We're doing a lot of hip scopes on Fridays in particular, so we're happy to have y'all. We love having visitors and shadowers if you want to see it in real time. And big thank you to everyone involved. Thank you to our panelists. Thank you to our team, Sherma Francis, Jen Beach, Devontae Bryant, and Cindy C. are not in the room currently, but they are what make this thing run. Without the team, this is impossible. I'm just a small part of this. Just a reminder, I know our clinic is hard to get into. Always keep in mind that Sherma is always able to see patients if I'm not. So if my clinic is booked out for a month or something crazy like that, or they're telling you that, then make sure the patient knows next step, ask for Sherma Francis, okay? Because sometimes the person booking appointments is not here. There's someone sitting at home, who knows what, working from home. They're not thinking about clinic dynamics. So just keep in mind, we don't have to make patients wait. Sherma can do anything I can do, probably better. Erin Barlow, once again, a round of applause for her. She made all this possible. All right. I thank you to Stryker Sports Medicine, Ronnie Shaban representing. Thank you for bringing the equipment to let us all see. And thank you all for spending your Saturday morning with us. Have a good one. Thank you.